Can you fix a fungal toenail or a deformed toenail by removing it? That's what I'm going to discuss in this video. You can see this patient has a deformed toenail and we're going to remove it. Now the question becomes is how will that grow back? Well, even before that, some of my patients will say, if you take my toenail off, is it even going to grow back? Well, yes, it will grow back. There's two ways that you can remove a toenail. One way is a nail avulsion, and that just simply means you avulse the toenail and let it grow back. The second way is a matrixectomy, where we introduce a chemical and stop the nail from growing back. In this particular situation, though, we're going to give this toenail another try and see if we can get it to grow in clear. So what we're going to do is perform a nail avulsion, and then we're going to treat the base of the toenail with an antifungal solution, or in this case, it's a cream called ketoconazole. And then we're going to put the patient on an oral antifungal medication called terbinafine, which was also known as Lamisil years ago. So we're going to treat them with both a pill and a topical. And it'll take about 6 to 9 months for this toenail to grow back, but there's no guarantees that it's going to come back clear. And why is that? Well, it's because we can't confirm that this is a permanent damage to the cells that grow the toenail, or if it's just a fungal infection causing the nail to appear this way. Now, there's a lot of different theories. Some people theorize that the fungus can infect and invade those cells that form the toenail and cause permanent damage to the toenail. Or there's the other theory that it's causing a temporary disfiguring or thickening of the toenail, and when we treat it with an antifungal, it will grow in clear. Now, this patient does recall that they had damaged the toe in the past and that they had also had the nail fall off and it grew back this way, but they weren't quite ready yet to have it permanently removed. So we're going to give it one last chance to come back by treating it with both a oral or a pill form of an antifungal called Lamisil or terbinafine, as I had said, and they're going to use this as a pulse dose. We give 2 pills a day for 7 days. They'll stop it for 3 weeks, and then they'll do it again for another week, and they'll do this for a total of 4 months. So it's a 1 week on, 3 week off, 4 month pulse dose. And then at the same time, they're going to use the ketoconazole cream, and we'll see if this nail will grow back. Now, it's going to take about 6 to 9 months, and I usually tell the patient, keep using that cream until the nail completely regrows. And if it's coming back clear, keep using it. Wait till the nail grows in. If it's coming back deformed, then most likely this is a permanent damage. And at that point, they're going to need to have a matrixectomy. So when you have something like this done, we put this large bandage on, then you're going to soak it in warm water and Epsom salts for 2 weeks. Sometimes it heals up a little faster than that, maybe 7 to 10 days. And these patients can get back to activity immediately. I don't restrict them from running or any activity. The next day, they can do whatever they like. If you have any questions about toenails or toenail fungus, drop it in the comments section below.